Hi, my name is Sue Lamb, and I'm an MSN student at the University of Texas in Arlington's Academic Partnership Program. Today I'm going to be presenting an educational process using the theory of progressivism. Progressivism uses the tools of problem solving, critical thinking, and a collaborative team approach to developing an educational process. During a clinical quality meeting that we held recently, it was discovered that the use of the rapid response team was not being utilized appropriately. We did a 3-month process to look back to see how often the rapid response team had been utilized, and it had not been utilized at all, and there had been 2 code blues and transferred ICU that had taken more than 2 hours. We decided to develop a subcommittee to include ICU, med-surg, women's services, as those are the most common areas that rapid response teams are called. Thank you all for coming. Today we called this meeting in order that we could discuss the problem of the rapid response teams. In the past few months, there have been several transfers to ICU and several codes that have been called, and a rapid response team was never instituted. Rapid response teams, as you know, need to be utilized in the case of a deterioration in patient's condition. And in order to improve patients' outcomes, we need to make sure that they are being utilized correctly.
Well, I've heard about the rapid response team in nursing orientation, but after that it was never discussed again. I'm not sure how many of the nurses actually and other staff know how the process works and how to utilize it.
That's interesting. Sounds like we need to do some education and reintroduce the process to the staff. We could also develop something that will remind the staff that's available and show them how to activate it when it's needed.
In another facility that I worked, we had signs in the patients' rooms that not only directed the staff, but it also helped the patients to understand what the process was in activating a rapid response team.
Well, didn't they have people calling all the time, even when maybe just to go to the bathroom if the nurse didn't respond quickly enough?
Surprisingly, no. We educated the patients at the very beginning of their admission about what rapid response teams were and what they were for, and that if they were to, if at all possible, call the nurse first. And we didn't have any problems with false calls. Right?
I think this would be a great addition to the process. We just need to develop a flyer that can be put in each patient's room that's easy to see. We could use Spanish on one side, make it easy to hang so that patients and staff can see it.
We've got the skills fair coming up in 2 weeks, and I think that would be a great time to start educating staff. Maybe we could create a poster board and a presentation where it explains how to activate a rapid response team.
Great idea.
This is the poster board presentation that was created by the subcommittee of the Rapid Response Team. The presentation will be given at the Skills Fair for all patient services personnel. Flyers that are shown on the board will be placed in all patient rooms and care areas in both English and Spanish. Education for the families and patients will be done at time of admission. This board will be explained by one of the subcommittee members. It will explain how and when to call for a rapid response team. Normal ranges for vital signs are shown, and if a patient has a sudden change or develops a change in a level of consciousness, a rapid response may need to be utilized. The role of the nurse is always in assessing, stabilizing, supporting, analyzing, evaluating, and educating for the need of the rapid response team. They are always responsible for transferring the patient to the ICU within a reasonable amount of time, if indicated. Outcomes and results for the use of the rapid response team is to ultimately improve patient outcomes by reducing the number of cardiac arrests, unexpected deaths, delayed transfers to ICU, and unnecessary transfers. In order to activate the rapid response, dial 0 on the patient's phone, then say rapid response and the room number. This will indicate to the hospital operator that the rapid response team needs to be paged overhead, and each of the members will be notified. by beeper.
This is the Rapid Response Team Education Board. These are going to be in the patient's rooms, and when you see that there's a change in a patient's condition, you're going to utilize the rapid response and follow these steps to call the nurse.
Okay. So whenever their heart range goes down or their blood pressure is low or too high, then we can call.
Yes,
Thank
and
you.
these will be on the wall in the patient's rooms.
Okay. Very neat.
This concludes my presentation of the Rapid Response Team's educational process. We were able to use the theory of progressivism with the tools of problem solving and critical thinking in a collaborative team approach. Thank you for viewing the video, and if you have any questions, please leave them in the discussion board. Thank you.